Hello, my name is Robert Martiniano, and I'm the Senior Program Manager at the Center for Health Workforce Studies at the SUNY University at Albany School of Public Health. The opioid crisis has affected many Americans. Over the past decades, death due to opioid abuse has continued to rise. Dentists are a major prescriber of opioids, falling only behind primary care physicians and internists. Additionally, visits to emergency departments for non-traumatic dental conditions, such as tooth decay, abscesses, and gum disease, have also contributed to the use of opioids. In efforts to reduce the volume and dosage of opioids prescribed to patients and give more guidance to healthcare providers, in 2016, the CDC issued opioid prescribing guidelines for chronic pain. Our study assessed the 3 years of dentists' opioid prescribing patterns in New York State prior to the implementation of the CDC prescribing guidelines. The data included medical, dental, and pharmacy Medicaid claims data from 2014 to 2016 for all adults 18 plus enrolled in the New York State Medicaid programs. Those included in the study needed to be enrolled in Medicaid for a minimum of 90 consecutive days at any period during those 3 years. Patients excluded from the study were those who experienced pain as a result of underlying illnesses or conditions that would justify the use of opioids, such as cancer or end-of-life palliative care. To summarize our findings, the majority of opioid prescriptions issued by dentists corresponded with dental office visits or dental-related ED visits. Nearly 80% were related to surgical procedures, both suggesting clinical justification for their issuance. Dentist prescribing patterns demonstrated general compliance with best practices in terms of limiting morphine milligram equivalents, or MMEs, per prescription. Only a small percentage of dental-related prescriptions exceeded the daily 90 MME and the 7-day supply limitations. The evidence in this study suggests that dentists were altering their opioid prescribing practices prior to changes in the CDC prescribing guidelines. The next step in this research would be to assess if these trends continued after implementation of the CDC guidelines. Thank you, and I look forward to any questions you may have.